Hi, I'm Simon Wade. I'm a student of physical therapy. Matt, do I have your permission to touch and locate some structures on you and take a video of it?
Yep.
Perfect, thank you. Got a bolster underneath his knees for patient comfort, and we're going to be palpating some structures on his wrist. I'm going to start with his palm turned down. If I slide my thumbs down the radius and the ulna till I get to the styloid processes. Just beyond that, I'm going to feel a ditch. This is going to be where and if I move medial from there, this is going to be where the radiocarpal joint exists. I can take the wrist in and out of flexion and extension to feel those bones moving around and popping into my thumbs. And if I want to identify some specific ones, I can start by going from the radial head of the radius here. I'm going to move medial. I can find Listers Tubercle. Matt, can you lift your thumb up? Perfect. I can verify that the tendon is going there, so I'm on Listers Tubercle. And if I move towards the third metacarpal from here, right when I drop into the ditch, I know I'm going to be on Lunate. And I can move in and out of extension to feel Lunate there. If I move a little bit further, but not as far as the actual metacarpal, I should be on Capitate. If I go just a little bit further, now I'm on the carpometacarpal joint, CMC. From here, I can find some other carpal bones. If I take the second metacarpal and I trace that towards the carpals until it drops off, now I'm on trapezoid, right in here, underneath the second, metacarpal. I can also find at the base of the thumb, if you lift your thumb up, Matt, in the anatomical snuff box, right here, you can relax now. I know that if I go proximal, I'm on the radial head, but if I stay where I'm at, I should be on scaphoid, and I can radially and ulnarly deviate to feel scaphoid pushing into my thumb. If I move towards that first metacarpal, I should be on trapezium. And Matt, can you lift your thumb up and down? Good. I can verify that I'm not on the first metacarpal, but on trapezium. On the other side, if I slide off of the ulna, the first bone I should feel in here should be Triquetrium. I can also radially and ulnarly deviate here to feel Triquetrium pressing into my thumb. And now I'm going to flip the patient's hand over. And if I trace the ulna down until I feel a large prominence here, that's going to be Pisiform. And if I bring the wrist into some flexion, I can actually move Pisiform left and right a little bit. But in extension, that's going to become quite taut and won't move. And if I want to find Hamate from here, I'm going to draw a line from Pisiform to the second metacarpal. And I'm going to move about half an inch until I feel a little lump in there. There it is. And now I know I found the Hook of Hamate in here. This is important because we know that between Pisiform and Hook of Hamate, we've got our ulnar artery and nerve. And that is our palpation for the wrist.